It was the fall of 1997, and I was engaged to be married. And I was having problems with pain in my leg, my left leg. It was more in the towards the hip. And for about 2.5 years, I hadn't been able to lay on my left side because it would ache. As soon as I rolled over off of it, it'd be fine. Well, then it started aching during the day and hurting really bad. And one day, it hurt so bad I had to leave work, and I was in tears. That just doesn't happen with me. So my fiance actually said, I want you to go see my doctor. There's something going on here. And I went to him. I'd been under the care of an orthopedic surgeon for 2.5 years. And I went to see this guy. He took an x-ray and found the tumor in my femur bone. It was about 15 centimeters by then. And he wasn't sure. We did a biopsy. The needle biopsy came out negative. And then he sent me to see an orthopedic oncologist. And so we get there, and this is probably in October. And he tells me, I think it's malignant because of the way it's acting. And so it was me and my fiance and my doctor and his nurse. They're all just, as soon as he said that, they're all just looking at me. I feel like they're just staring at me. And all I did was go, okay, so how do we fix it? I don't know if they were expecting me to break down or cry or whatever, but I just said, okay, what do we do to fix it? I had another biopsy because he wanted to make sure. It was a surgical one this time. It was November 13th. They had to put me under. It was not done until like 8 o'clock in the evening. And we flew out the next morning for Reno and drove to Lake Tahoe and got married. So on November 15th, we got married. And we came back, and I had my first surgery December 4th. And they had to basically remove most of my femur bone and the whole rest of the leg above the joint. And so they ended up doing a partial replacement. So I had a partial hip, so it was bone to metal grinding. It was very painful. But I went back to work after about 6 months full-time. 3 months I started part-time. And I just couldn't focus. Either too many drugs and you can't focus, or drugs and you can't focus because of the pain. So I ended up retiring in January of '99. The next thing I know, they're telling me in the fall of '99 that it has metastasized to my lungs, both of them. So I had my first thoracotomy January 13th of 2000. Had my second one on my right lungs. The first one was on my left. January 31st of 2000. So they were just a couple weeks apart. I had a thoracic surgeon tell me to give up after I only had 2 lung surgeries. Supposed to be, a really good surgeon. I just looked at him. I just couldn't believe what I was hearing. I mean, I was so mad I was in tears, and I just looked at him and I said, you have no idea who you're talking to. And I got him left. Went on and healed from that after a while. And then in the fall again of October of 2000, they found another tumor in the tissue. The biopsy, because they had to split the bone and take a chunk out, and when they did that, it spilled into the tissue, contaminating the tissue. That's why I don't like biopsies. I won't ever do another one. We went along, and about it was 2002, in April, and I had my 3rd thoracotomy on the left side. By then, my hip was really bothering me. I was taking so many narcotics and stuff, and that's when I decided my surgeon sent me to see Dr. Lisa Stearns, and that was a lifesaver. The pain pump was implanted in July, and it just made a big difference. I got off all the oral narcotics. I don't like taking oral medication because you can't drive. That's the reason why we went to the pain pump. I had gotten up to 120 milligram pills of morphine that I was having to take for the pain. And, I had 3 teenage boys at home that I was having to drive around. And I was falling asleep driving. You can't do that. can't live your life like that. So that's where the pain pump made a big difference.
So the pain pump was like 1/200th of a dose of oral medication, but it blocks the pain, so she can drive safely and legally and go through her daily life and, you know, do clothes and wash clothes and do stuff that any normal person would do. When she was on those medications, she couldn't do it. She couldn't function. She'd be in and out of it, and then if you mention something about the drug use, she'd get mad. And then again, I have to say, like, okay, it's not really Loretta talking, that's the Loretta on the drug. She's addicted. And then they brought her down. And it took a while to get her off of the drugs because you can't just stop. You know, it took them a while. But once they did, you could just see her personality come back and her old self come back. And they don't realize that's happening to them at that time.
No, you don't, because I didn't realize either.
Yeah.
Even now, I didn't even think about that.
Yeah.
Then we moved to North Carolina in 2003. 2004, April, I had my 4th thoracotomy on the left side again, so that was 3 on that side. June, I had my 5th one to remove tumors. Through all these 5 thoracotomies, I've lost both lower lobes, and then just, you know, picking out nodules and stuff. So we came back from North Carolina in 2005, and went about a year, and it had come back in my lungs. So I did a medical trial at some point, but then what happened was they found another tumor in my leg again, in the tissue, and they had to pull me off of it because you can't have any kind of progression of the cancer. Unfortunately, it was shrinking the nodules I had in my lungs just a little bit, but we'd never had anything like that. Chondrosarcoma, there's really no treatment but surgery at that point. Another surgery set up for, it was like the end of September of 2006. And he got in there, and then all of a sudden he closed me back up, and when I woke up, it seemed like, man, you just put me out, you know? And they had to close me back up because the tumor had actually wrapped itself around the joint. So they had to reschedule it because he needed more time. So when I finally did have it, it was like the first surgery. They had to dislocate my hip, clean all that stuff out, take the tumor out and tissue on the inside of my groin area this time. That one I had a really hard time recovering from. It took me months. And then the tumor showed up again in the fall. That was when I said, okay, you can take my leg now. So they did the disarticulation at the hip. And I finally got rid of the main source. I have not had any more thoracotomies. My surgeon I had before decided he didn't want to try and do it because he said he didn't want to put me 6 feet under. And I agreed with him. I didn't really want to go through another one because the last 2 took me about a year to recover from. You know, they break ribs, you know, they go in, they split your ribs. It's a very painful process, and it's hard to heal from. I wasn't getting any younger, so I was 36 when I was diagnosed. And so then things started changing a little bit, and I found out that they have a radiation process. So 2010, in the summer, I had radiation treatment on my right lung, and it actually did destroy them. It killed them. It took about 5 years for them to deflate. They calcify and then they deflate. After that, I started, that was 2010. 2013, I had another radiation treatment on my left lung, and that was, there were all 28 treatments. I went to the same radiologist. And then they had to follow up with that after that that was in the summer of 2013, and then at the end of December through February, I did another round of radiation on my right lung. Unfortunately, 6 months after that, 3 more popped up. Of course, and they're all, 1 in a left lung and 2 in my right lung. So that's what I'm looking at now, and I've been in 2 medical trials. I'm still in 1 right now, so it's keeping it stable. And that's kind of what I'm looking at now, is just doing that. But We're going on the 20th year. This year is my 20th anniversary of my diagnosis and my marriage, which I'm very happy. Rick's been amazing, so that's my story.